Hello, my name is Jasmine Flott, and I'll be presenting on blastomycosis. What is it? The description of this disease: blastomycosis is a disease caused by infection with parasitic fungi affecting the skin or the internal organs. It is caused by inhalation of spores of the Blastomyces dermatitis. It grows in moist soils, particularly in wooded areas and long waterways. Blastomyces dermatitis is a soil-inhibiting fungus. It can spread from the lungs to other organs of the body. An example is the bones and the skin. It cannot be spreaded through human to human contact or from animals to human. Men between the ages of 20 to 40 years are more likely affected with this infection. Blastomycosis could possibly be found in the Midwestern, Southeastern, and South Central states of the United States, especially on the Mississippi and Ohio rivers. This disease is most common in Minnesota, areas like St. Louis, Washington, and other counties. Gilchrist disease was what they first called this illness. This was in honor of Thomas Casper Gilchrist, who first recognized it in Baltimore, MD, in 1894. Other names include North American blastomycosis, Chicago disease. This fungal infection is more common among dogs, especially the hunting breeds. The reason it may be more common in dogs is because the dog sniffs with their nose to the ground, which increases the chance of inhaling the canidia. Dogs are more prone to infection because they can be used unintentionally to locate hotspots in endemic areas. The forms of this disease: Blastomyces dermatitis is considered one of the dimorphic fungi. It can form inside and outside the body. The fungus can also form a sexual state. The so-called telomorph form is Aleomyces dermatitis, which forms a gymnothecium. Blastomycosis is a chronic granulomatous disease, which means that it progresses slowly. Although the pulmonary and skin involvement is the most common, Blastomyces dermatitis frequently affects the bones, prostate, and other organs. More frequently, blastomycosis presents as cutaneous or respiratory disease. Prognosis: the prognosis or outcomes for blastomycosis varies. About 50% of infections do not even produce symptoms in some people or animals. Those patients diagnosed and treated appropriately, usually have a good outcome, although they need to take medication for many months. Immunosuppressed patients with blastomycosis have outcomes that range from good to poor, depending on the person. Although some may recover completely, the mortality rate or death rate is about 29%. People with minor skin sores, lesions, and relatively mild lung infection usually recover completely. The infection can lead to death if not treated. In epidemic areas, the yearly incidence of blastomycosis is approximately 1 to 2 cases per 100,000 people. Some symptoms of this disease: usually symptoms occur about 3 to 15 weeks after being exposed. Some symptoms are fever, bone pain, cough or coughing up blood, shortness of breath, skin sores, chills or night sweats, weight loss. This infection may be considered more common among and more severe with people who have a weaker immune system. The duration of this fungal infection varies with different patients. This fungal infection can spread to the tissues that cover the brain and spinal cord. Meningitis causes fungal meningitis. Some diagnosis: histopathology of surgical biopsies can be done, urine antigen tests, or serum antigen tests can be taken to diagnose this fungal infection. Having examination or culture samples of an infected area or material of the body can be diagnosed for blastomycosis. Doctors can also test a urine sample for proteins or antigen released by the fungus. Culture and blastomyces can be taken from saliva, bronchial washes, lung biopsies, skin, and other areas that are affected, including the tissues. Some drug of choice could include fluconazole, itraconazole, ketoconazole, amphotericin B may be used for severe infection. It is also the drug of choice and can be very toxic and must be administered intravenously for several weeks. This is just a few drug choices that can be taken if a person is infected with blastomycosis. This image here is a composite photomicrograph of a tissue specimen from a patient who was infected with blastomycosis, and it shows an abundance of large budding cells that have been conferred in chains. Some treatments. Some antifungal drugs can be used for treatments of blastomycosis. If severe blastomycosis is treated with, like we stated earlier, amphotericin B and can be given intravenously. If blastomycosis is mild to moderate, itraconazole will be given by mouth. People begin to feel better much quickly with the treatment, but the drug must be continued for 6 to 12 months. If not treated, blastomycosis slowly gets worse and seldom leads to death. Some preventions. There are no known hands-on measures or vaccination for the prevention of blastomycosis. Illness caused by blastomycosis can be reduced by early recognition and appropriate treatment of this drug. To try to prevent this disease, a person should avoid traveling to areas where the infection is known to occur. There has been recent work that has suggested exceptional potential for a live recombinant vaccine strand of Blastomyces dermatitis, which lacks the surface antigen and has important virulence factors for the organism, which facilitates binding to the target cells. This vaccine has been highly immunogenic in laboratory animals and is being evaluated for vaccine trials in human volunteers. Some outbreaks. The lesions on the forearms of this man in the first picture was misdiagnosed. His name is Chris and he's from Kentucky. He was misdiagnosed for 3 months. He was treated for a cold, then bronchitis, then the flu, then bacterial pneumonia in the hospitals until the lesions came out. A pulmonary doctor had recognized it once he had done a bronchoscopy of his lungs and found the initial infection along with 8 biopsies of the lungs and one on a lesion that confirmed that it was blastomycosis. We have one of this lady who is infected with blastomycosis. It is cutaneous skin disease on the nose area. Then we have one in this animal, ocular, which means eye. He has blastomycosis in his eyes. Some tests and exams. A smear test can be done to direct microscopic identification of broad-based budding yeast. Chest CT scan, a chest x-ray scan can be done. Skin and tissue biopsy, a spectrum culture and examination can be done, and also a urine culture can be done. Little statistics. In 2014, 32 blastomycosis cases were reported, similar to 34 cases reported in 2013. Wisconsin may have the highest incidence of this disease of any state, with yearly rates ranging from 10 to 40 cases per 100,000 persons in some northern counties. An analysis of blastomycosis deaths in the U.S. found that 1,216 blastomycosis-related deaths occurred during 1990 to 2010, and the overall age-adjusted mortality rate was 0.21 per 1 million person a year. The median age of 2014 cases was 42 years, ranging from 13 to 78 years. 22 cases, which is 69%, were males. 66% cases were white, 6% were black, 6 were American Indians, 3% was another race, 19% were of unknown races, 75% cases were hospitalized for a median of 7 days, range 1 to 24 days, 3% case died as a result of their infection, 75% case had pulmonary infection, 3% case had an extrapulmonary infection, and 22% cases had disseminated infections. Overall, blastomycosis is uncommon. Most cases occur in the U.S. and Canada. In states where blastomycosis is reportable, yearly incidence rates are approximately 1 to 2 cases per 100,000 population, as I mentioned earlier. My conclusion. In conclusion, blastomycosis can be cured if treated in the right amount of time. You should follow up with your doctor to make sure that the infection does not return. Antifungal treatments is usually continued for 6 months and recovery is usually complete. A doctor may recommend antifungal medicine when the disease is severe or spreads outside of the lungs. Antibiotics do not work against blastomycosis, so you should see a doctor. People with minor sores and relatively mild lung infection usually recover completely. The infection can lead to death if not treated. If blastomycosis is mild to moderate, itraconazole will be given by mouth as stated earlier in the previous slide. People can begin to feel much quickly with treatment, but the drug must be continued for 6 to 12 months. If not treated, blastomycosis slowly gets worse and can lead to death. Here are my references, and this concludes the end of my presentation.